I want to thank you all for joining us for this media briefing about COVID-19 in Idaho. My name is Nikki Forbingor, and I'm going to be moderating today. Please note that everyone should be muted unless they're speaking. Given our 30-minute time frame today, our opening remarks will be brief. Health and Welfare Director Dave Jepson will start us off, and then Public Health Administrator Elke Shaw-Tulloch will provide some updates as well. With that, I will go ahead and turn it over to Director Jepson.
Well, thank you, Nikki, and welcome to everyone today to this week's COVID-19 briefing. Overall, our state COVID-19 numbers continue to look really good at the state level. The statewide 7-day moving average for cases per 100,000 remains below 10 and has for a number of weeks. Our COVID-19 testing positivity remains below 5%. 2 weeks ago, we did see a bump up in testing positivity, but this last week it was back down around 4.2%. The percentage of long-term care facilities with active COVID cases is currently at about 5%. And COVID-19 hospitalizations and ICU admissions are stable, but still higher than we would like to see. On the vaccine front, we recently crossed a milestone with over 600,000 Idahoans who are fully vaccinated. We've added a new feature to the coronavirus.idaho.gov website. Under the Vaccine tab is a link to the new mobile COVID-19 vaccination clinics in Idaho page. This new page shows current and upcoming mobile clinics and includes a map of Idaho, which displays the location of the mobile clinics. There are many organizations across the state who are working very hard to make the safe and effective COVID-19 vaccine as accessible as possible in every corner of the state. And I want to thank them for their efforts. They're making a difference. And with that, I will hand it over to Elke.
Great. Thank you very much, Director Jepson, and hello, everyone. We appreciate you being here. I have a few things that I want to touch base on as an elaboration of some of the things that the director pointed out. I also want to note, in addition to the mobile vaccine site, we also, as you look through our vaccine data, you'll notice that we have a CDC vaccination data posting also on our vaccine dashboard. Last week, we added this county-level vaccination data that are available on the CDC website to our vaccine data dashboard to provide additional information about the vaccine coverage among residents of Idaho counties. The residents of counties that border other states may receive their COVID-19 vaccine in another state, as we all know. And nearly all states right now are sharing their data with CDC, where it's then combined to provide a more comprehensive picture of vaccination for some of our border counties. So as an example, our immunization information system indicates that 46% of Teton County residents are fully vaccinated. However, many people living in Teton County work and recreate in Wyoming and even get their vaccinations in Wyoming. So when CDC combines our data with other states, including Wyoming, that rate then of fully vaccinated residents of Teton County is closer to 50%. So while the CDC data are not as timely as the data we have in our immunization information system, we think this provides the most comprehensive picture of vaccination status among Idahoans. And the CDC data, for your information, are about 48 to 72 hours behind the data that states might have on their own websites. So there's a slight difference between the two. The other thing that I wanted to talk about is regards to trends of cases in children in various age groups since January. So as the director has stated, the number of COVID-19 cases among all people, all ages, has been decreasing since January. We're very excited about that, and we're seeing that across the board in different age groups. The incidence rate among children ages 0 through 4 has decreased by about 79%. So we're seeing about 20 cases per week are being reported compared with 100 cases per week at the start of the year. Cases among younger school-age children aged 5 through 12 years old have decreased by 86% since January. Also about 20 cases per week being reported right now compared to the approximately 120 cases we saw in January. And lastly, cases among teens aged 13 to 17 have decreased by 87%. And about 40 cases are being reported each week now compared to nearly 300 cases per week that we saw in January. The last thing I wanted to touch base on is the hospitalizations due to COVID. And we know that the number of cases that resulted in hospitalizations each week has also decreased by about 83% since January. The most significant declines that we've seen have been among older adults, with an 80% decline in the number of people ages 80 years and older hospitalized in May compared with January. Among those over or under the age of 18, the number of hospitalizations each month has decreased by 42% overall since January, with the largest decrease among teenagers aged 13 to 17, which is about 63%. So with that, kind of my summary statement is really that even though we're seeing declines in cases, we are still seeing cases in children and children in the hospital due to COVID. These disease rates in children are generally reflective of what we're seeing with community transmission. And we know that vaccines work. And so we want Idaho's children to get the vaccine so they can make sure that they get their summer back and that they have a good outcome for the school year, because even though they just ended one school year, the next school year is not too far away. So we have some opportunities for children to get the vaccine over the summer. And with that, Nikki, I will turn it back to you.
All right. Thanks, Elke. And thank you, Director Jepson. We'll now take questions from the media. You can raise your hand in WebEx or type your question into the chat area. When I say your name, please unmute yourself and announce your name and media outlet before asking your question. And then if you can, please remember to clear your hand when you're done. All right, it looks like our first question is going to come from Audrey Dutton.
Hello, Audrey Dutton from the Idaho Capital Sun. Wondering if it's possible to get a breakdown of how many of the new cases we're seeing are among vaccinated individuals, like what the percentage is.
That's a great question, Audrey. And luckily we didn't mention at the top of the hour, but we also have our full team of people here as well to help answer questions. And I know that is something that we are working on. So I'm going to turn it over to Dr. Turner. She wants to give us an update on that.
Thank you, Elke. Yeah, Audrey, it depends on what time frame you're looking at, but it's higher than 90%. So it depends on the age group and the time frame, but higher than 90% of cases have no record of being vaccinated that we're aware of.
Great, thank you.
Okay, our next question is going to come from Rachel Cohen.
Hello, this is Rachel Cohen with Boise State Public Radio. Last time we talked a bit about vaccine incentives, and I was wondering if you could update on where the conversation about those stand and if that's something the state is still considering.
Yeah, thanks, Rachel. I'll take that. Yes, we are still considering all options. I mentioned that last time that we still have everything on the table right now. We are definitely looking at what's happening in other states, if we can learn anything from other states about how effective some of those incentive programs are in increasing vaccination rates. So of course there are things ranging from lotteries for cash prizes, all sorts of incentives that are listed as prizes, contributions to college savings funds, different donations of all sorts and sizes. So we are actively monitoring that and what's happening with other states, and we're also in active conversation. So again, nothing is off the table, and we're considering all options.
Okay, our next question will come from Hayat Noormine.
Hi, Hayat from the Idaho Statesman. Thank you. I just had a quick question about President Biden's announcement that he wanted to do, get 70% of U.S. adults vaccinated by July 4th. Realizing that that's probably not possible in Idaho, I was just kind of wondering what Idaho's kind of doing on that front, if it changes your strategy at all, or what you're trying to do to help that.
Thanks. Hi. We certainly want to get as many people vaccinated as possible. We know that vaccines work. They're helping to keep our case rates down. As you said, that is a target that's Idaho is not achieving necessarily across all age spectrums right now, but we continue to see progress in our vaccine uptake across the state, not as quickly as we're seeing in some other parts of the country, but we're making slow, steady progress. And we want to continue to do everything we can to make sure that vaccinations continue to roll out across the state. And I'll see if Sarah Leeds wants to add anything to that.
Elke, thanks. I would just add that the program is continually meeting with other states and figuring out what kind of goals they're setting, talking with CDC, our federal partner, for best practices for across the board for equity and just administration in the vaccine administration in the general public. And so we continue to do outreach events and see, kind of what sticks, media strategies and promotional items and things like that. So those are the things that we're doing.
Thank you. And just a quick follow-up, is are you doing any additional statewide incentives that other states have started?
As I mentioned a little earlier, we're looking at all options right now. We want to see what some of the other states are doing and see their effectiveness. But we're working, of course, with all of our local public health districts. We're working with our CVAC members, all the people that we can engage in how do we either incentivize or motivate people to get vaccination, and then also how do we make it easier. So it's kind of as I said, used the term before, we're casting sort of a broad net across the state because of what might work in one area might not work in another. But we definitely want to look at a statewide perspective what we can do. And so right now we're taking an inventory. We're trying to collect an inventory of all the different motivators and incentives and kind of novel ways of getting vaccine to people are occurring, so we can at least see where some of those gaps are and things that we need to fill. It's an ongoing process for sure, but we're continuing to push on that. And Sarah, I don't know if you have anything that you wanted to add. Looks like you might have wanted to say something.
No, nothing to add. Thanks.
Okay. Thanks.
Okay. Our next question is going to come from Kyle Fonensteel.
Hi, Kyle Fonensteel from the Post Register. Can y'all hear me all right?
Yes.
Thank you. So pollsters at the State Commission in late April found that 70% of Idaho adults getting vaccinated is our best outcome. When do you think that we could realistically expect that to happen?
That's a great question, and I wish I had a crystal ball. And I don't know if any of our other teammates here have a magic answer to that. Like I said, we're doing everything we can to continue to encourage people to get the vaccine. If we look at some of those, some of the predictions based upon the current estimates, it's later on in the fall that we might see us reaching that sort of rate. But it just depends on people's personal actions, and we want to do everything we can to encourage that. So, I wish I could answer that very definitively for you, Kyle, but I'll see if any of my other teammates here have anything else they want to add.
Elke, this is Chris. I just might add that we're, just want to celebrate a milestone that we are over our seniors, 65 and older, we are over 70% in that group. And yes, of course, we want to bring everybody along, but the seniors were always the top priority, which is why vaccination started first in that age group. And so we're really happy. I feel like you're, crossing the finish line first, and now we have to kind of turn our focus to the younger populations. While continuing to encourage more seniors to get vaccinated. We'd really love to see them all get vaccinated. But that is important to note that among our seniors, the ones that, as Elke mentioned earlier, we're very gratified to see the dropping hospitalization numbers in those older adults. That's just amazing to see. So we do see success. We are not sitting back by any means. We're full court press, but we've had success among our seniors, which is really something to celebrate. And I'm still hoping we can do better than 70% in that age group. we've had 75, I'm looking at just making sure the number, 75.6% of seniors have initiated vaccination, at least got a single dose. I still think we can get to 80 in that group, and I'd love to see that.
A quick follow-up if I can. So what does not reaching the 80% vaccination goal by September mean for our state in our fight against COVID-19? On face value, given our previous goal, it seems a little concerning, but I guess could you explain what sort of risk level this exposes us to and some of the change in thinking around vaccination goals, herd immunity, et cetera?
Yeah, thanks, Kyle. And Dr. Hahn, do you want to continue with your comments?
Sure. Yeah, Kyle, you're absolutely right. We're very concerned. We're pleased at how far we've come, but we realize there's a lot of tough work ahead because the folks that, as I think we talked about last time, the folks that were eager to line up at mass vaccination clinics, they've mostly gotten the vaccine, and now we've got that hard work of reaching out and doing. I just heard this morning from one of the local public health districts, they're very pleased at a local event they did, and they got 20 folks vaccinated. That's where we're at now. We're doing small clinics in different areas, rural areas of the state, smaller communities, and trying in employer-based settings. And we are going to have to just keep chipping away at this, and how we can help support the local health districts and local health facilities, doctors to do this work is really where we're focused right now. So yeah, I think that we're very worried. As you know, with fall, there's two things we're worried about. One is, of course, a resurgence of COVID, in particular, possibly even with new variants or variants that haven't really played much of a role to date. They could surge in the fall. We just don't know. And of course, we're worried about influenza. We were so fortunate in this last season, for reasons that aren't fully understood, that we had such a mild flu season. Part of that might have been we were all socially distancing, wearing our masks, washing our hands, all those things we've been kind of trying to do for flu. A lot of people got vaccinated for flu also last year. It was kind of a record as far as people getting vaccinated. So really, we were able to defeat the flu last year, which we've not had time to really celebrate because we had COVID to worry about. If we can do as well this year with flu, that's great, but we are worried about people letting down their guard, influenza surging back at the same time as COVID, and the hospitals could get overwhelmed. Even if COVID doesn't surge too much, if we have both going on, it could add up to quite a challenge. So we are worried about the fall, and we are full court press through the summer. Of course, we know people are going off and taking some vacation, but we want to keep our providers and our communities thinking about when's their good chance to get the flu shot and the COVID shot. Sorry, not flu shot quite yet. And also when kids start going for their back to school shots, can they go ahead and get their COVID vaccine at that same time as they're going in for any of their needed back to school shots, those that are 12 and over.
Okay, thank you, Dr. Hahn. Our next question is going to come from, it'll be a second question from Audrey Dutton.
So to follow up on Hayat's question, Sarah Leeds, you said you're looking at what sticks in terms of getting Idahoans the vaccine. And Elke, you talked about that as well. What is working at this point and what isn't working? I mean, recognizing that you're still gathering that information, but so far, what have you been able to glean?
Yeah, I'll start and Sarah can follow up. I would say some of the things that we're seeing that are effective right now is just some of the things that Dr. Hahn just talked about. It's those, small, meet people where they are environments where we have, let's say a vaccine clinic at a public library, or showing up at a, the homebound individual's location, or places where you're seeing 10 doses, 15 doses, 25 doses. It's those small opportunities where people have to go kind of collect, maybe get their questions answered, have more of a conversation about it potentially. So that's what we're seeing right now. That's been very effective. And then I think, as we have those mobile mini grants that we've talked about in the past, and using some of those efforts around the state to, again, meet people where they are, sort of generate that community engagement opportunity. And then, of course, we're also seeing some successes right now with people having that ability to talk one-on-one with their physician. Some locations, and I can't even think of course, because we're on this call and I don't have it right in front of me and I can't think it off the top of my head, but there are some locations that are doing some small incentives that also seem to be stimulating some demand. But really, it was working with business owners, business leaders. We've heard some stories for some, here's an actual example, working with dairy industry and going in and actually, showing up on payday Friday, working with the business owner, being able to work with those small environments and give those vaccinations where it's not really an interruption to someone's day. It's provided right there on site while they're doing their job. So those are some of the things that are working right now. It's that access piece. Incentives, I think we're still seeing some of those roll out, and I'll see if Sarah has any more concrete answers with that.
Yeah, no, okay. I was just going to emphasize the part you said about providers. I mean, it's not necessarily an incentive, but one of the strategies we know is incredibly effective in helping folks who are have low confidence in vaccine is talking to their healthcare provider. And so we're working to ensure that our providers really are armed with all the information that they can and feel confident talking about the vaccine, and really being able to ask the patient what their concerns are and address those concerns. And of course, we know those are time consuming for a provider, and we just are trying to look at ways that we can empower providers and help providers have the time to be able to do that, so that people can make informed decisions and feel confident in their decision to get vaccinated.
Okay, we'll have another question from Hyatt.
Hi, I was just wondering if you could elaborate a little more on the impact of the new variants on COVID cases among children, whether you've seen a surge of new cases among those under 17, and apologize if I missed this at the beginning.
Thanks, Hyatt. You did not miss that at the beginning. We didn't touch on that, but I'm going to see if that is a Dr. Turner response or Dr. Hahn or Dr. Ball. We'll start with Dr. Turner.
Thanks, Elke. We are not seeing it any more common in children than we are in adults. In fact, if we look at as a proportion, it's adults that are more likely to be reported as infected with a variant. Now, that may be because of the way sampling is done, perhaps, but we are not seeing it like variants running rampant in children compared with adults. It's actually more likely to show up in an adult case than in a child case.
Okay, I am not seeing any more hands for questions unless Hyatt, did you have another question? No? Okay.
Thank you.
Sure. All right, well, we'll wrap it up for today then. We are planning another media briefing at 2:30 Mountain Time on Tuesday, June 22nd. That's 2 weeks from today. You can watch for those details on Monday, June 21st. Thanks for joining us today.